Welcome to another segment of our Partner Spotlight series, brought to you by the members of the Regional Chronic Disease Collaborative. The Regional Chronic Disease Collaborative members work together, combining their resources and expertise to help prevent the development and progression of chronic disease across our region. Our Partner Spotlight initiative is to help share innovative approaches being used throughout our region to improve population health.
Thanks, Jill, for joining me today for our Partner Spotlight, today focused on health equity. I'm Tressa Keller with Mountain Pacific. Joe is a clinical pharmacist with Logan Health. Joe, would you like to introduce yourself?
Hello, Tressa. Thank you for the chance to discuss social determinants of health with you. My name is Joe Tabler. I'm a clinical pharmacist with Logan Health, and I've been involved with a number of projects with DPHHS concerning social determinants of health. It's kind of an area that I'm very interested in, and I think it's got a big outcomes possibility in healthcare management as well.
Thanks, Joe. As you support clinical care delivery throughout many avenues in the outpatient care, can you describe Logan Health's health equity projects that you're currently working on?
Our health equity project is targeted towards a high needs group, which is basically hypertension and hyperlipidemia in an age group of 18 to 64. Logan itself has got a social determinants of health process that's screened every wellness visit. But we go a little bit further with our study work, in that we're adding an extra social determinant on there. And namely, we're going to be talking about problems related to living alone. And we do it each and every interaction we have with the patient. So if we follow them up on a monthly basis for home monitored blood pressures, we will ask them the same questions every time. It may seem a little redundant to them, but things change. Doing it once a year is not a good enough spotlight and putting a spot on where they are at that time. Things change, and things change rapidly. So we have used the Logan basis, and then we've added on for our project as well. We also add the Z codes into each and every interaction we have with the patient into the chart, so that again we can pull that data out at a future interval when we want to find out where we're at with each of these patients.
Great. And as you set out on these projects, what did you hope to accomplish?
The big thing we want to hope to accomplish is, my belief is, and this goes back a long ways for me, ever since I've been in ambulatory care, primary care is about 70% psychosocial, 30% medical. And because of those situations, we find out that the psychosocial side has as big as impact as the medical side. So if we can get an idea of where the patient is struggling at, what their big concerns are, and try and get community resources or clinic resources to address those needs, we should get a better health outcome at that point. All of this goes into a combined effort to try and meet the patient where they're at and address the needs that they have.
Wow, that's great, Joe. That is great to know about the different components that play into the overall outcome. From this, what results or changes did you experience?
One of the results I've experienced is that each and every clinic has got a totally different demographic. And as we work through the different demographics in each clinic, we have to have different options to try and help them with their psychosocial needs as well. And that's probably where we've had one of our biggest barriers to getting where we need to, is trying to make sure we've got those resources both in the community and within our clinic so that patient's needs can be met. I can take an example. For instance, if a patient, we notice they do not come in very often for a lipid test, we'll try and find out why that is, whether it's transportation, whether it's cost of the lab test, or fear that they might find out something they really don't want to know. So again, that's where our social determinant work comes into it. We get them to talk to us. It's opening up a dialogue with them.
That's great. Really just taking that data and making it useful information sounds like it's the next step in how you're providing care. Did you identify any other barriers that clinic staff have?
clinic staff have right now is when we ask them to do it each and every time the patient has an interaction with them, especially for our grant-based patients, gets to be a bit difficult. The grant-based patients are labeled as such in the EMR, and they've got a little tag that says we're doing blood pressure monitoring or lipid monitoring, but making sure the consistency is there all the time seems to be a bit of a problem. Nobody's perfect. And if I said I was, I'd be lying to you. So each one of us have got times when we will not do everything we need to do as we've been trying to do. So what we do is we look at the group as a whole. As long as we're hitting a good target number in that, we've got to be satisfied with where we're at. And we may miss 1 or 2 times, but we'll also make it up on the next few. Big thing is that we're trying to make attitudes change. We've got to remember that to change a habit takes 7 times to try and change that. So if I have to do it 7 times with each patient, so be it. We'll get there eventually.
That's great, Joe. I love the persistence as well as the purposeful planning in these projects. What aspects of this project are you most proud of?
Some of the things I've always felt is that healthcare does not need to be inside the 4 walls of a clinic. And in that, this project has allowed me to go out and do some community work. Like we've had a blood pressure clinic at a community dinner. And at that community dinner as well, we've talked about healthy eating. Probably not the best thing to talk about at a community dinner because everybody's got together with friends and they're eating very profusely, so to speak. So we talk about eating things like Mediterranean meal plan, which in Montana isn't the most favorable meal plan. As most people know, it's a little bit low on red meat for the average Montanan. But again, we still try and do some education and try and bring this in slowly. So the biggest thing that I've really enjoyed is taking this out to the community, meeting people where they need to be. The other part of the project that's been really helpful is trying to get blood pressure cuffs into people's hands. We may think it's a minor thing to have a blood pressure cuff, but if you're already sitting on a very fixed income and with inflation going the way it is, if I can get them a blood pressure cuff, that seems to be a trigger for them to actually be compliant in doing those blood pressures and getting them back to me. So again, 2 things I've been very proud and very happy about is getting out into the community so that we can actually be seen as interactive in that community, and also being able to supply equipment through other means that people can get the testing done that they need. Next step will be to talk about how we can do lipids in the community as well. We take 1 step at a time, and we're going to make the change for the average person's life.
Those are some great steps, Joe. Thanks for sharing them and congratulations. It sounds like you're already making an impact on these communities. As other facilities listen to this, what piece of advice do you have for others who may attempt this?
Education, communication, education, communication. I can't say that enough. And like I said, I could say it 7 times for each one, and then it would become a habit. But you have to make sure your team is on side. When I first started, I didn't do enough educating and communicating with the teams I was working with. And again, it made me get frustrated. We weren't getting the numbers I wanted to see. But then I realized I was actually the fault. So I had to make sure I backed up, did the education, and tell the people why we wanted to do it, and all the staff, the MAs, the providers, everybody, why we wanted to do this screening at each and every encounter we had, because we were trying to get better data and find out how fast data could change as well. So again, the big thing I would say is communicate. Make sure you pick out your key person in a clinic. And it may not be who you think is the formal leader. It may be the informal leader. And find out who the informal leader is and get them on your side, and you'll have a champion that'll work with you and through you, and to get the data that you need to show that you're making an impact on those people. The other thing probably I would say is make sure you take a good enough time to determine what is available for resources in your community. Because without those resources, you feel like you're going uphill all the time. And pushing a snowball uphill is not a lot of fun. Eventually, it's going to run over you. So I would always say try and find out what's available in the community and how we can integrate that into the care of our patients.
That's great, Joe. Thank you for being a champion across Montana for healthcare and equitable access. Thanks for doing this partner spotlight. We sure appreciate it. And please reach out with any questions.
Thank you, Tressa, and thank you for the opportunity to be able to talk about the needs of patients outside of strictly medical needs.
Thanks, Joe. Take care.
If you are interested in sharing your innovative approach, please contact one of these Mountain Pacific representatives. Thank you so much.